You could be in for a wait, unfortunately, if you're headed to your local hospital because of the flu. The Centers for Disease Control is reporting a sharp spike in flu cases in Southwest Florida and across most of the country tonight. 4 in your corner, Sam Sosa, talking to some patients in South Fort Myers who say they've been experiencing backups.
Patients crowd the ER waiting room at Gulf Coast Medical Center.
There's some people in there that are sick, but it's definitely crowded in there.
Brian Nauman describing some of those patients wearing medical masks as the flu continues spreading in Southwest Florida. Lee Health says they've seen a spike in flu cases. This graph shows over the last 2 weeks, more than 300 people tested positive for the flu, a huge spike compared to the less than 150 cases reported this time last year, represented by this red line. Those coming to the hospital can't be guaranteed a wait time, according to a Lee Health spokesperson who says they see people with severe conditions first, like Brian, who broke his rib.
They got me in there pretty quick because it was triage and I guess it was an emergency.
Some people turning to websites that claim to give estimated wait times at emergency rooms if you plug in your zip code. Lee Health says those numbers aren't reliable. Instead of coming here, they recommend going to one of their 4 walk-in clinics or your primary care doctor.
Most of the time, people who have true flu don't even come to their doctor offices.
Primary care doctor Krista Zivkovic in Cape Coral agrees, telling me your best bet to reduce the time you spend with the flu is to go to your doctor as soon as you feel symptoms.
If we can treat you within 3 days of the start of symptoms, we can get medication that's antiviral, which will help decrease their symptoms.
But is there a time when symptoms are severe enough to warrant a visit to the ER? After all, the CDC reported an increase in deaths related to the flu in 2017.
Usually if they can't tolerate liquids for over 4 or 5 hours and they're not able to even urinate anymore because they're so dehydrated, then they would need some IV fluid replacement.
Sam Sosa, Fox 4 in your corner.
For that full list of Lee Health's walk-in clinics, just go to fox4now.com. A spokeswoman said, though they're similar to emergency room services, they cannot guarantee wait times there.